Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Thalassophobia Fear of the ocean and deep bodies of water. Thalassophobia is the intense fear, phobia, of oceans, seas, large lakes, or other large bodies of water. In some instances, it can interfere with your quality of life. /r/n/r/n People with thalassophobia may experience physical symptoms such as sweating, dry mouth, and heart palpitations when they're near a large body of water or even when just thinking about the ocean. It may also cause anxiety and other emotional symptoms. /r/n/r/n This photo contains content that some people may find graphic or disturbing. /r/n/r/n Thalassophobia shares symptoms with other specific phobias, such as claustrophobia. The defining characteristic of thalassophobia is that these symptoms are triggered by exposure to or thoughts about deep bodies of water. Thalassophobia can include both a fear of drowning in deep water and a fear of what might be lurking in deep water. /r/n/r/n People experience thalassophobia in different ways. Some people might panic when swimming in deep water, being on a boat, or when unable to touch the bottom of a pool. Others experience fear just thinking about the ocean or when looking at pictures of deep water. /r/n/r/n Symptoms of thalassophobia and other specific phobias can be both physical and emotional. /r/n/r/n While everyone's experience with thalassophobia is unique, there are some symptoms that are commonly felt. These include /r/n/r/n Thalassophobia can trigger a panic attack, which may induce symptoms such as /r/n/r/n You may experience these feelings when you are in a large body of water or when you are simply nearby. You can also experience these feelings when just thinking about large bodies of water. /r/n/r/n People with thalassophobia and other phobias can experience a flight or fight response when they are near or thinking about a large body of water. The fight or flight response is your body's way of preparing for danger. It can cause physical responses like rapid breathing and accelerated heart rate. /r/n/r/n It might help to remember that the panic response in water is more dangerous than the water itself. If you know you have untreated thalassophobia, it can also help to always swim with another person or in the sight of a lifeguard. /r/n/r/n Thalassophobia is similar to some other phobias and is related to these fears. /r/n/r/n Thalassophobia can cause distress while you are in the presence of certain triggers. Long-term, untreated thalassophobia can also cause other kinds of mental health problems. /r/n/r/n If you or a loved one are struggling with a phobia, contact the Substance Abuse and Mental Health Services Administration, SAMHSA, National Helpline at 1-800-662-4357 for information on support and treatment facilities in your area. /r/n/r/n Specific phobias, such as thalassophobia, can be diagnosed by your primary care provider. You can also get a diagnosis from a mental health professional such as a psychiatrist. /r/n/r/nMegalohydrothalassophobia is a fear of large things underwater, such as whales, reefs, or shipwrecks. /r/n/r/n If you're not sure if you need to contact a healthcare provider, you can also self-test. A self-test can't give you a diagnosis, but it can help you decide whether you want to move forward with getting a formal evaluation. /r/n/r/n Online tests are available to help you assess your symptoms. These tests may show you images of deep bodies of water and ask questions that can help determine how severe your symptoms are. /r/n/r/n To diagnose thalassophobia, Your healthcare provider may ask you questions about things such as, /r/n/r/n. There isn't much data on the number of people who experience thalassophobia, but smaller studies have found that most people have some fear of deep water. /r/n/r/n. Gallup survey from 1998 found that around 46% of Americans are afraid of deep water in swimming pools, while up to 64% are afraid of deep open water. /r/n/r/n. The Diagnostic and Statistical Manual of Mental Disorders, DSM-5, includes specific criteria for diagnosing specific phobias. To meet the DSM-5 criteria, a person must demonstrate /r/n/r/n. In previous editions of the DSM, a person also had to demonstrate insight that their fear was irrational or disproportionate to the situation. As of 2013, this is no longer a diagnostic requirement. This means someone with thalassophobia might think their reaction is justified and sensible, even if it limits life activities or causes significant distress. /r/n/r/n. While thalassophobia is typically caused by a past traumatic event, such as a near-drowning experience or being frightened while swimming, other factors may contribute, including your upbringing, personality type, and even genetics. /r/n/r/n. The causes of specific phobias are not well understood. They may differ from case to case. Some people may develop thalassophobia without a recognized trigger, while others may develop the phobia following a traumatic event. /r/n/r/n. Many researchers believe that specific phobias are caused by a combination of genetic and environmental factors. /r/n/r/n. This means you may be genetically predisposed to a specific phobia. For instance, it's believed that some people's brains may have a dysfunction in fear processing. This can lead to disproportionate fear towards specific situations. /r/n/r/n. However, being biologically at risk for a phobia may not be enough. An actual disorder may not develop unless you have a traumatic experience or you are exposed to triggering events or ideas. /r/n/r/n. Research shows that certain genes are associated with certain specific phobias, but as of yet, no studies have looked at the genetics behind thalassophobia. /r/n/r/n. However, some believe there is a genetic factor to phobias like thalassophobia based on the Darwinian theory of evolution. Those who subscribe to this theory believe early people who were afraid of deep bodies of water and avoided them may have lived longer to pass down their genes, and their aversion to deep water. /r/n/r/n. This theory is supported by research that indicates that specific phobias are moderately heritable, although the exact percentage can vary. For example, it has been found that for specific animal phobias, heritability is around 45%. /r/n/r/n. Thalassophobia can also be caused by traumatic events. A childhood near-drowning experience, witnessing a shark attack, never learning to swim, or even being told scary stories of the ocean are just a few examples of possible events that could trigger thalassophobia. /r/n/r/n. By associating a specific situation, such as being in deep water, with a panic response, a phobia of that situation can develop over time. /r/n/r/n. Some researchers believe that parental behavior may contribute to the development of specific phobias in children. Children who have overprotective parents may feel as if they have limited control over their environment. This can contribute to anxiety and the development of specific phobias. /r/n/r/n. A parent can also model their own fears to their children. For example, a person may develop thalassophobia because a parent openly expressed a fear of deep water. /r/n/r/n. One or a combination of factors can put you at risk of developing a fear of deep water. /r/n/r/n. Thalassophobia triggers can include :/r/n/r/n. Left untreated, thalassophobia can greatly limit a person's life. /r/n/r/n. Unfortunately, only about 10% to 25% of people with a specific phobia seek treatment. Because treating a specific phobia often involves confronting the feared stimuli, many people with phobias may avoid seeking treatment, but those that do may benefit from one or more of these approaches. /r/n/r/n exposure therapy is a popular and effective choice for treating specific phobias, including fear of the sea. This treatment involves exposing a person to their feared stimuli at increasing levels of intensity until fear extinction is reached. /r/n/r/n for someone with thalassophobia, this might start with looking at photos of the sea. Later, the person might watch videos of the ocean or deep water. Eventually, the treatment will involve exposing the person to the ocean or a pool. /r/n/r/n through controlled exposure, the person learns that the feared stimulus is not dangerous. Once this happens, they can begin to associate it with more positive outcomes. /r/n/r/n cognitive behavioral therapy, CBT, is a type of psychotherapy. It is effective at treating a variety of anxiety disorders, including specific phobias. /r/n/r/n in CBT, a person learns insight into their own thought patterns and behavioral responses. Through this insight, they are able to alter their thoughts and subsequently change behaviors and feelings. /r/n/r/n for specific phobias such as thalassophobia, CBT is often used as a complementary treatment in addition to exposure therapy. However, some people might prefer CBT to exposure therapy because it involves less initial distress. /r/n/r/n in extreme cases, medication can be used to treat specific phobias. This is often done alongside other types of treatment, or for specific situations. For example, if you have thalassophobia and are going to be on a boat, you might take medication to treat your symptoms during the activity. /r/n/r/n some medications used for this purpose include /r/n/r/n thalassophobia can impact your quality of life. It may prevent you from socializing or engaging in recreational activities. If your symptoms are causing you great distress or isolation, it may be time to talk to your healthcare provider. /r/n/r/n coping with thalassophobia can be challenging, but there are things you can do to help limit your reaction to triggering stimuli. These approaches offer natural ways to manage your phobia. /r/n/r/n sometimes it can help to focus on your breathing. If your thalassophobia is causing a panic attack, try the following. /r/n/r/n progressive muscle relaxation can help you release tension in your body, which may also help reduce anxiety. The process is simple. /r/n/r/n mindfulness is a thought practice that helps your brain slow down and focus on the present. When practicing mindfulness, you stop and consider how your body feels, what is happening in your mind, and what is happening around you. /r/n/r/n mindfulness can help you overcome the fear you are experiencing in the moment and become more self-aware. There are a number of simple mindfulness exercises you can do. Try starting with a basic body scan meditation. /r/n/r/n visualization may help some people overcome a specific phobia. /r/n/r/n you do not have to complete this visualization in one day. Instead, do the visualization until you start to feel anxious, then imagine yourself returning safely to shore. See if you can go farther each time you do this. /r/n/r/n if this exercise makes you too anxious, you can also try doing it in the presence of a healthcare provider or a trusted person. When you combine this type of visualization with therapy, it may help you overcome your thalassophobia more quickly. /r/n/r/n it is important to take care of your own needs while you are trying to overcome your thalassophobia. Try not to self-isolate. Make sure you have someone to talk to and consider joining a support group. /r/n/r/n specific phobias can't always be prevented, but it is possible to avoid some of the situations that might lead to their development. /r/n/r/n Thalassophobia is a specific phobia of deep water. Specific phobias are irrational fears of specific stimuli that are disproportionate to the actual danger. /r/n/r/n People with thalassophobia may have a panic attack when near deep water. In severe cases, a photo of the ocean or a swimming pool may be enough to trigger symptoms. /r/n/r/n Thalassophobia can be treated with therapy. Treatment usually involves gradual exposure to the triggering stimulus. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.